And good evening. We're going to send you right to the governor's office for a special address now from Governor Asa Hutchinson on COVID-19. He's been ready for a while, and he looks like he's ready to start any second now. He's expected to announce or tell us about the numbers, what we need to do, and talk about the vaccine. And there may be some other things thrown in there that we're not really aware of, but we will find out now from Governor Hutchinson. Oh, no, he's not quite. Fooled me. The governor looked like he was ready to go. In fact, they were putting a mic on him about 10 minutes ago, and he was in his place and ready to go. There's a lot to talk about tonight. The statistics are not good. As you know, if you've been following the news, we have gone through a rough time and continue to face a rough time nationwide. The difference between now and other surges is that it's nationwide. And here it's
tonight I'm speaking from the governor's office in our state capital. Almost 20 years ago, I was part of our nation's response to the terrorist attack on September 11. We all remember the horror and heartache of that day when we lost over 3,000 Americans. But even as we witnessed tragedy that fateful day, we were awestruck and inspired by the heroic efforts of our firefighters and our first responders as they went into burning buildings to save lives. Today, our nation faces another deadly crisis. It is a global pandemic that has claimed the lives of more than 280,000 nationwide, and just in Arkansas, the virus has taken the lives of over 2,800 of our neighbors, friends, co-workers, and loved ones. Let's put this in perspective. Right now, this virus is one of the leading causes of death in Arkansas, but it is even more personal. Many of us have lost someone we care about. I have made the difficult call to express condolences to the families of some of those we have lost. Those calls were to the loved ones of an educator, a state employee, and a police officer. Last weekend, I called Jennifer Kennemore of Osceola, who lost her husband Dickie to the virus. He was a former mayor of Osceola, he was a friend of mine, and he helped bring Big River Steel to Arkansas. He died after multiple weeks in the hospital. He fought hard but couldn't make it, and he will be missed. That story of suffering and loss has been told too often. And just as we had heroes after 9/11, we have heroes today. It is the courageous work of our healthcare professionals and emergency responders who each day put their own lives at risk to save others. As I speak tonight, we have nurses, doctors, and staff in our hospitals and long-term care facilities who have looked death in the eye for 9 months, and they have not wavered in their commitment and determination to beat the virus one human being at a time. Others have lost their business, some have lost their job and income, and early on, some did not get to say goodbye to a loved one because of COVID restrictions. In one way or another, this virus has impacted us all, but we have squared our jaw and faced the adversity. We have met the challenge just as those who have gone before us confronted the tough times of life, and we all have hope for a better day ahead. 9 months ago, we had no ability to test for COVID-19 in our state, but now we are testing on average more than 10,000 Arkansans every day. In fact, I asked the Department of Health to run the numbers for the individual Arkansans who have received a COVID test. I was informed that 1.3 million individuals in our state have been tested. These are not repeat tests, but tests of specific, different individuals. Our state has a little over 3 million people in population, so we have tested more than 40% of all Arkansans. Whether in testing, data analysis, hospital coordination, or compliance with guidelines, we have made progress every day. Tonight, Arkansas is at another critical moment in this struggle to turn the tide of the pandemic. Today, we are 2 weeks past Thanksgiving, and we are seeing a surge in coronavirus cases. This spike in cases was predicted by our health officials and is the result of everything we did over Thanksgiving, even with the best of intentions. We're also 2 weeks away from Christmas, and unless we take the right precautions, science tells us the cases will continue to rapidly accelerate. We do not want to have a triple surge. As we look to the future, my hope is that all Arkansans will celebrate this special season of the year. In fact, I hope our holiday lights are brighter and more beautiful than ever. But we must do a few things differently this year. If we fail to follow our public health guidelines over the next 2 weeks and through the new year, then our hospital staff will be challenged like never before. Let me emphasize that our hospitals are doing an amazing job of coordination, developing surge capacity, and maximizing ICU bed space. Even with this, I was informed today in Jonesboro that crowded hospitals lead to backed up emergency rooms, and backed up emergency rooms lead to ambulances waiting in line. And when ambulances wait in line at the emergency center, then the first responders may not be able to respond to a 911 emergency call as quickly. We have all seen the television images of El Paso, New York, New Orleans, and other cities where the hospitals are overflowing and patients are in field hospitals or hallways. We don't want that reality to hit Arkansas. There are already calls for lockdown orders and directives to shelter in place. This is not my vision of a good Christmas or a good way to start the new year. And most importantly, there are better solutions. So what do we need to do? A couple of suggestions for the holidays. First, be smart about travel. Let's travel less, but in some cases it will be necessary. I remember hitchhiking home for Christmas from college one year. Mom was worried and it didn't make much sense, but I did it anyway. Let's use more sense this Christmas and everyone will understand and probably enjoy a more quiet and peaceful holiday. But if you do travel out of state, then consider getting a rapid test before and after you travel. Remember, this virus is highly contagious. When you are indoors without social distancing or when you are not wearing a mask, you then increase significantly the opportunity for the virus to spread. And older individuals have a greater risk of hospitalization and death if they contract the virus. Someone who is over 65 is 5 times more likely to be hospitalized and over 90 times more likely to die as compared to a young adult. So while we might not have any symptoms ourselves, we could still be carrying the virus and give it to someone who is older and much more vulnerable. Also, let's innovate and be creative about the holidays. I love the idea of one family from Little Rock who said they were having their Christmas outside. They were going to have a fire pit and do everything outdoors. Not a bad idea, but you may have a better idea. Figure out what we can do to have a meaningful holiday, and yet let's not be the reason the virus spreads. Let me assure you that to those of the Christian faith, I have confidence Christ will understand a little deviation from the norm this year. And for our Jewish community or other faiths, the greatest joy would be the gift of safety to all the family. And for our business and employer community, we might forego the holiday party for this year, or you can have your social distancing get-together approved by the Department of Health. That is what my office is doing. Now, some of you are saying, why don't you just put more restrictions on our businesses or close down restaurants, gyms, hair salons, and barbershops? Of course, these are all small businesses that are already under very strict guidelines. We are consistently watching the data and making decisions based upon what will mitigate the spread of the virus. We are limiting seating capacity in indoor and outdoor venues. We have issued numerous fines to the small percent of businesses that have failed to comply with the COVID guidelines. We have a mask mandate in place, and we have asked local law enforcement to educate and enforce the wearing of masks when social distancing is not possible. This week I was in Benton, and the local leaders talked about the high percentage of people wearing a face mask. But I was greeted by a few who believe the mask does not make any difference. My response is that I have to be guided by the science and medical experts who say the mask is our principal defense and the best way to keep businesses open. This is not the time to dismiss the advice of scientists and public health professionals. Now is the time to rally around each other and show grace in times of need. Of course, if you're in your car, on the road, or on a tractor by yourself on the farm, then no one is asking you to wear a mask. But otherwise, please do the safest thing. The real solution to getting life back to normal is people being self-disciplined by wearing a mask, socially distancing, and limiting our indoor gatherings to those we know are safe. Those are the steps that will make a difference versus putting additional restrictions on businesses that are already complying with all the health guidance and when there are no cases coming from a specific place. And if we find there are cases arising from a particular business, then we will take action. But more restrictions on businesses would add a whole host of additional challenges, from increased unemployment to closed businesses and bankruptcies, all right during the holiday season. Others say we should close schools. Let me read a letter from Rain Glover from Conway, who is in the 3rd grade. Quote, "My mom is a night shift nurse, so that means she has to sleep during the day, and so she can't help me with homeschool. My dad works during the day, so he can't help me either. I know you know how important it is for kids like my sister and me to be able to go to school. So can't you find a way to keep school open? Kids shouldn't fall behind. Lots of kids will be in the same situation," end quote. Thank you, Rain Glover, for making the case for school, and I agree with you. We do have to pivot to virtual school as needed, but our teachers understand there's no substitute for providing school in person as consistently and safely as we can. This day is historic for another reason. We have a vaccine on its way. Today, the FDA Advisory Committee said yes to the emergency use authorization of the first coronavirus vaccine in the United States. This gives us confidence and hope that we will win this fight. Within days of final approval, the Pfizer vaccine will arrive in our state. I have authorized the first dosages to be distributed to our healthcare workers. The next round of vaccine will be distributed to our nursing homes. Initially, there will not be enough vaccine to cover all healthcare workers, and the hospitals will have to prioritize. But there will be second and continuing deliveries after that, and we will get everyone covered. It is very critical that we provide the vaccine to our most vulnerable citizens in our long-term care facilities. In Arkansas, 79.5% of our COVID deaths occur in those 65 years or older. I expect the FDA to approve additional vaccines this month, and Dr. Jose Romero and his team at the Department of Health are working around the clock to ensure these vaccines are used for those with the greatest need. We will continue to prioritize the vaccine distribution until it is widely available. It is my belief that the determination and ingenuity of our pharmaceutical industry, combined with the support of our federal partners, will result in universal distribution in historic and record time. It may be late spring before everyone in Arkansas has access to the vaccine, but it will be here, and if we all do our part, we will beat this silent killer together. There is hope and a bright day ahead. The experts say that before the vaccine can be successful in defeating the virus, that 70% of our population will need to accept the vaccine. I have confidence in the vaccine. In fact, Susan and I will be taking the vaccine when it is our turn. There will be no government directives to be vaccinated, but that should not be necessary when it is so important to our nation and state. I first declared a public health emergency on March 11, 9 months ago. This allows emergency use of telemedicine, flexible education in K through 12, and many other emergency actions needed during this pandemic. The latest emergency declaration expires in 2 days. Today, I'm declaring a continuation of the emergency through the end of December. During this pandemic, the General Assembly has been a good partner. Legislators have answered the call in appropriating money for struggling businesses, for our hospitals, for rental assistance, for food banks, enhanced unemployment compensation, and our testing and contact tracing demands. But some have argued that the legislature should join in the decision to continue the emergency. Today, I'm asking the General Assembly to conduct a meeting as a committee of the whole to support and affirm the current public emergency. We are all in this fight together, and it takes all of us, arm in arm, united, to defeat the biggest public health crisis in our lifetime. The best athletes in sports are inspired by two things. They're motivated by their teammates and winning. In football, you want a running back who can smell the goal line and get there. In track, you need a runner who has the extra kick of energy when they get to the final stretch and see the tape. But the athletes who care about their teammates and want to do all they can for the team contribute even more to the victory. To my friends across the state, we are teammates. From the young people who understand what is required to protect their grandparents, to those in nursing homes or assisted living, you have been troopers throughout this year. To the essential workers who provide our food, energy, transportation, and health care every day. To the teachers in the classroom, and to our state workers who get the job done under pressure. Together, we will get to the finish line. You inspire me and you encourage others. Our nation has always come together during times of crisis and emergencies. When people understand what is necessary and the public good at stake, they always rally and come together. Arkansans have answered the call in every war, in every national challenge. Today, we are in the midst of a pandemic and we need every Arkansan to be on the team. Thank you, God bless you, and may God have His special blessing on the people of Arkansas. Good night.
Governor Asa Hutchinson on a rare, in fact, I think it's the first time ever, 7 o'clock address to the state about COVID-19. On this, the 274th day of COVID-19 being a part of our lives. There are several takeaways from tonight's address by the governor. This was not a press conference. This was an address. If this was a pre-Christmas pep talk to follow health guidelines, but some of the takeaways. Continuation of the emergency declaration he gave us back in March. He's going to look to the Arkansas General Assembly, the legislature, for their approval to continue the emergency till the end of December. Also, he talked about the vaccine. There will be no government directive for the vaccine. He did say that healthcare workers would be the first ones to get the vaccine, and those 65 plus in nursing homes will be the second in line to get the vaccine. And he pointed out that 79.5% of Arkansas deaths are among people 65 and up. Real quickly, let's look at the numbers tonight in Arkansas. 202 new cases of COVID-19 were reported today as we near 20,000 active cases across the state. Our hospitalizations went down a bit more, but we're still seeing more than 1,000 people in the hospital fighting the virus. We also learned today that another 34 Arkansans have died. And as the governor mentioned, the FDA Advisory Committee voted tonight to recommend full FDA approval for the Pfizer vaccine. The next steps will be for the FDA to give its final authorization. Doses will be shipped to every state. You heard the governor break down as to who is going to get what, when, and then each state will enact its own distribution plan, which was announced tonight by Governor Hutchinson. 5 Arkansas pharmacies that have the ultra-low temperature freezers needed to store the Pfizer vaccine. The vaccine must be kept at negative 70 degrees Celsius, and once they receive the vaccine, these pharmacies will be in charge of transporting it to hospitals and administering it to healthcare workers and first responders. And a new COVID-19 clinic is opening to treat those who need help, but don't need to stay in an ICU. Tonight at 10, THV11's Mercedes McKay will introduce us to the people behind this clinic and how it's already serving people fighting this virus. Now, you may be wondering why the governor now? Why did he choose tonight to make a 7 o'clock address, to interrupt your regular viewing? And it's obvious. The numbers, and to keep a triple surge from happening, a pep talk before Christmas. He talked about innovation over lockdowns, innovation, and not making sure, or not making people locked down instead. And he looked for creative ways that people can celebrate Christmas. Understand, all of this is happening on the governor's watch. I talked to him in a recent interview and asked him about that. I said, you know, you realize that when people look back on your career as governor, the first word that's going to come to mind is COVID-19. And he looked at me and said, what I want the people to remember is balance. You heard it again tonight. He's not going to lock down. He's going to ask for our cooperation. He called his teammates, and he's going to make sure that businesses are protecting themselves and protecting you, but he's not going to lock down the economy. He is going to urge strongly that we all wear masks, keep our social distance, and wash our hands frequently. Thank you for joining us for this rare visit from the governor at 7 o'clock. Your hope is that he won't have to do this again, which means our numbers are going down. Join us at 10 tonight. We will have more. And if you want more on the facts, text the word facts to 501-376-1111 for daily COVID-19 updates. Join us back here at 10 tonight. Good night.